for inviting me. I just really think this is such an important topic because we know that epilepsy impacts our physical health. We see that all the time, but what we really need to focus on, as well as keeping our children physically safe, is also the mental health effects and the social consequences of epilepsy and what that looks like for our families. So why is it that we need to discuss this? We know that epilepsy has devastating social and psychosocial effects. And if we don't address those ahead of time and be proactive with it, we can really notice a decrease in our patients' mental health. So our objectives for today are to gain a better understanding of how epilepsy truly impacts our children and their families, identify the mental health comorbidities, and really describe the importance of how our schools can get involved and how us as parents can have that advocacy role for our children on the school campus. So what are some of the social consequences of epilepsy? What does it look like for our children and on the school campus and, even in their homes and in our communities? We know that epilepsy affects the overall quality of life in patients and their families. We know that they struggle with emotional, behavioral, and relationship difficulties. And then we know that epilepsy constitutes a huge, significant burden to the children and their families, which really indicates our need to be proactive in our mental health services that we're providing for these children. So what are some of the psychosocial impairments that we notice either in a clinical setting or that you may see on a school campus or even in the home? With a lot of our epilepsy, children with epilepsy, we notice persistent worrying about their seizure disorder. We know overall that our children with epilepsy have a poor self-concept and a lower self-esteem than children with other serious chronic medical conditions. We know that they also struggle with a lower social competence at school, so that's peer-to-peer interaction, and that they struggle with our perceived stigmas that we see. There was a study that was done that showed that 24% of people thought that having a child with epilepsy in the classroom would actually be disruptive to their other children's learning needs. And so there's this stigma that surrounds epilepsy and has for a really long time. And we'll go over a little bit more specifically what that may look like for our kids so that we know how to better interact and create an atmosphere and an environment that's going to be one of safety for them. Another thing to kind of look at is that in another study that we talked about, more than half of the children in a particular study asked and wanted help in handling their seizures at school, talking to other people, talking to their teachers, talking to other students. They really wanted to focus on asking for that help. And then another big piece to look at is in our adolescent population, right? When we're looking at our adolescent population in terms of their developmental abilities at that particular time age, we're looking at them wanting to be independent, their driving, their ability to hang out with friends on their own, all of that. And a lot of times with our adolescents who have epilepsy, we unfortunately have to take away a sense and a loss of that control. We have to take some of that control back because sometimes we're telling them, you can't drive, or we really need to make sure that we're watching you a little more carefully, whether you're with your friends or sports you're playing and that sort of thing. So we want to make sure that we're recognizing how epilepsy really impacts our children and our adolescents in their appropriate developmental stage. We know that our kiddos with epilepsy oftentimes, unfortunately, have difficulty time making new friends. And a lot of that, I think, is due to the reason that our kids naturally with epilepsy most of the time will socially isolate, right? Because they feel different from their friends. They feel like, and they know something's different. And a lot of times it has to do with the anxiety and the fear that they may have seizures on a school campus or even out in the public. And that just is a natural tendency for them to want to kind of close in and not really be out there and involved with everyone. And because of that and a lot of other things, our kiddos do experience bullying and teasing from their peers on a school campus. So it's really important to make sure that we're addressing those needs pretty early on in a treatment setting. So moving on to kind of stigma and epilepsy. And we know that epilepsy is one of the world's oldest recognized condition. And what's interesting is that it's been dated back to 4000 BC, at least written record-wise. But we just didn't know what it was called at the time, right? There were a lot of different misnomers, a lot of different stigmas, and a lot of different things epilepsy was around. They just called it something else, right? And unfortunately, that stigma still surrounds epilepsy today. Through the fear of other people and not knowing, through misunderstanding, through discrimination. As our kids move into adulthood, some things kind of change in their job situation or maybe even on the school campus. And so we want to make sure that this bullying, this discrimination, misunderstanding, and this fear is really going to be a part of our conversation with everybody around us, because the more that we know about epilepsy, the more our children are going to have this source of empowerment on the school campus. And we do know, working in a clinical setting, that parents often withhold the medical diagnosis from the school personnel because they're fearful of their child being judged, and they don't want their kiddo to be treated any differently than anyone else. So it's really important to encourage parents, encourage the children themselves to advocate for themselves and really talk about the condition that is affecting them, not only physically, but in an emotional and a social way as well. Sometimes patients experience with epilepsy, these are a couple key things that we hear on a frequent basis and in studies. This is what they experience with epilepsy. This is how they feel. They're fearful of deterioration. They're fearful things are going to get worse. Our adolescents are fearful of having to depend on other people. And as our kiddos get older and they move into the adult population, depending on other people, right? Not maybe being able to live on their own. And some of those things that with our independence that we work on building in our children as they get older, some of those, sometimes unfortunately, we have to kind of go backwards with them and really help them build on what our expectations are and making sure that they're going to be safe wherever they're going to be. Desperation and insecurity, they feel like they've lost a sense of power, shame, right? They feel bad about kind of what's going on and how epilepsy affects them. And then really just feeling different that there's something that they don't have control over, and that this is something that truly affects them and affects them with their interaction with their peers, with their family, and with the social environment outside their home. So for a long time, really when we were working with patients, physicians, patients, and everybody really focused solely on controlling the epilepsy physically wise, right? We're giving you medication, we're trying to make sure that everything's under control and that you're going to be safe. But really in recent years, we've tried to be more proactive in a sense of being able to provide early identification of some of the major comorbidities that our kiddos and adolescents and young adults face when they've been diagnosed with epilepsy. One of them is depression, and we know that depression is very, very frequently under-recognized and under-treated in children who have epilepsy, up to 30%, and I'm going to say that some of these stats in the presentation are a lot lower than they probably are because these studies are very old. There aren't a lot of new updated studies that are going to promote kind of more mental health and epilepsy. I think there should be, but I'm just going to say with a grain of salt, the percentage-wise, if I had to guess, is going to be a lot higher than what I'm presenting to you. So up to 30% of children and adolescents who've been diagnosed with seizures also have depression as a comorbidity, which means they also have depression along with their epilepsy diagnosis. And then those that have the depression, there's about 63% of children who also had an anxiety disorder. So we're looking at anxiety and depression as two kind of the biggest components of what our children with epilepsy are going to be facing with their epilepsy diagnosis. We know that there's a higher rate of suicide found in children and adolescents with epilepsy than that's found in the general pediatric population. And kiddos with epilepsy are at risk for depression, anxiety, social isolation, bullying, and suicide. And then among deaths related to epilepsy, suicide is rated as one of the top causes of death. So that's even more of a reason to make sure that we're being proactive with recognizing some of these signs and symptoms, which we'll go over next, of really how to address talking to our kids and getting them help early on. So the next slide, I've added in here a very simple, easy to read characteristics of what you may see in children and adolescents who are experiencing signs of depression. I always like to tell people depression doesn't always show up in the way we think it should, or the way that we see in movies, or maybe we've experienced ourselves, right? Not everyone is going to be crying and crying all the time and not really able to express kind of their emotions. Sometimes what we see is more irritability, more anger, right? More sensitivity to rejection. We've got the social isolation here. We've got a loss of interest in activities. Our eating may change, right? Our behavior might change in a sense that they don't really care about anything anymore. They're going to be more reckless in things that they're doing, in the alcohol and drug use with our older kiddos. And self-esteem. We already have a lower sense of self-esteem in children with epilepsy. And so some of these thoughts may be a little more increased or intense with our kiddos who have seizures. So inappropriate guilt, feelings of not being loved, hard time concentrating, which comes along with epilepsy most of the time anyway. So sometimes it's hard to tease these out, but really what I'm going to say is just pay attention and be proactive in a conversation with your kids as they get older in an appropriate way, and make sure that their sense of self is being taken care of just as much as their epilepsy in a physical sense. Anxiety is prevalent up to 34%, and I'm going to say even more in children and adolescents. They struggle with anticipatory worry, which is basically, well, I'm worried that another seizure is going to happen. What if it does happen? What are we going to do? Who's going to respond? All of these things, a kiddo, as young as 3 years old, 4 years old, can have these worries. They just don't know how to say what the concern is. Social phobias, right? So fearful what's going to happen in public. I don't want to go out in public. I'm going to stay in the confinement of my home because that's where I feel safest. And then separation anxiety from our little ones, right? They know that their parents are their safety, their caregivers are their safety. And so to move away from that in any other type of social situation, we do see that separation anxiety. Another thing I'm going to note is there was a recent study in 2021 that came out analyzing the perspectives of over 600 adults with epilepsy, caregivers, and their healthcare providers. And what's fascinating is that even though this is an adult, what's fascinating is that over 50% in every category showed that caregivers and patients reported being extremely anxious, afraid of having a seizure in diverse situations or different environments. While driving in a public place, 77% were fearful of having seizures when they were alone, over 50% when they were asleep, and 57% when they were showering. So we know that epilepsy is very disruptive to the quality of life of people, and even more important to continue to support our mental health needs in our population who is dealing and living with epilepsy on a daily basis. So now with the mental health piece, we're going to hop gears real quick. And now that we know more about kind of where our mental health is going to sit with epilepsy, where is epilepsy and our academics come into place when you're in school? There are a couple different options, and I'm going to do a very, very brief overall level of IEPs and 504s. And the biggest thing to note is we know, and the reason we're talking about this is because epilepsy often occurs in childhood. And so therefore it's most likely the most common neurological condition that school professionals are going to encounter. And so that's so important because we really need to partner with the school to create a plan and make a profound difference in making sure that our kids with epilepsy on the school campus are set up for success. There's a couple different ways that we can do that. And I'll go over those in just a few minutes on what to look for as a parent and what conversations to have as a parent. So really, studies have shown that epilepsy has some pretty common academic struggles, some things that we're going to notice that may play a part in our children's learning who have epilepsy. So it's just important to note that anytime a patient's having a seizure, depending on which part of the brain, right, the seizure is impacted, our memory and language impairments is a big one, and up to 70% of children and adolescents will struggle with memory impairments, and that's not including any of the medication that might be somehow having some side effects for them or whatever the case may be. That's really because of the seizure. And then our attention. We know that it's a very common academic struggle with attention. We have a lot of comorbidities as far as ADHD and our epilepsy kiddos. So just kind of paying attention to that. We know that epilepsy overall has been found to negatively impact intelligence, processing speed, the attentiveness of the child in the classroom, their ability to perceived organization or making sense of things that you see on a quick basis, and then really self-regulating. They struggle with these different factors while in the classroom setting. On the next slide, I have a really cool little graph that we'll go over. We're not going to go over all of them, but it's here for you to look at a little bit more in depth. But it really goes over what are some of the common things that we see in an academic setting on the different types of learning disabilities, anxiety, depression, things to look for that specifically in studies have shown to affect children and young adults and teenagers with epilepsy. So really, what is an IEP, right? What does that even mean? You hear the word thrown around all the time, and each state offers IEP education and IEP supportive services to children and their families on the school campus. But what really is it? And what do we need to take from this? And what do we do with it? So basically, in a broad spectrum, an IEP is where a child can qualify for special education services. Okay, so a child is going to receive a full individualized evaluation by multiple specialties, and that's really going to determine if a child's going to qualify with one of the 13 disabilities that are listed. And the biggest piece to take away from this is that, does your child need special education services? So even if they have epilepsy, if their intellectual disability, their cognitive functioning, their speech, if there's something that's not being affected through the epilepsy, then they may not necessarily qualify for an IEP. We have a lot of patients who don't qualify for an IEP. They are academically on target alongside their peers. And so really an IEP is for those kiddos who are falling behind cognitively speaking, and needing those extra pull-out services or services in the classroom to help them succeed. The biggest thing with an IEP is that the school is required by law to be reviewed annually. And the purpose really is to set specific, reasonable learning goals that are defined by the services that are going to be set up, the interventions that are going to be set up to make sure your child meets those learning goals through multiple different ways: accommodations, modifications, and support services. The biggest piece I want to make sure that people take away from an IEP is there's a big difference between accommodations and a modification. The biggest thing is that an accommodation changes how the student learns the material, but it does not change the material itself. And that is going to be what's the focus, in a 504. But an IEP makes modifications, okay? An IEP allows the school and the parent and the teacher and everybody on the IEP team to make modifications and changes to what the student is being taught or what they're expected to learn. So the basic difference is, with a modification, it's going to change the expectation. For example, if a child is trying to learn multiplication problems, the child may just be expected or modified to only do addition problems. So there you're changing the actual academic expectation of what that child is going to be learning for the school year. And an accommodation isn't going to change that, but maybe in the multiplication, in the same situation, maybe in the multiplication, they might provide you with different tools and different things that might help this child learn that same expectation a little bit easier. So that's the difference between the two. So a 504 is very simple in that it's a blueprint. It's just a quick blueprint, but how the school is going to support a student with a disability and remove the barriers to learning, which is basically making those accommodations, right? You're not changing the learning, you're going to remove the barriers. And when does this fall into place? a lot of times, when a student isn't benefiting from instruction, when they return to school after a serious injury or a mental impairment, right? So epilepsy will qualify with that. And then they're not eligible for an IEP. So our suggestion, or I always suggest personally, that if a kiddo does not qualify for an IEP because maybe they're functioning a little bit high, we always suggest that they have a 504 in place. And that's really, really to make sure that if they're missing school days, if they need to catch up with work and they're not going to be penalized, and their grades aren't going to suffer because of that. Maybe we're going to be addressing some medication side effects, kind of like drowsiness or attention concerns. So really, the 504 plan is set up in place if your kiddo is not going to qualify for an IEP, but there's some other things that we're going to be looking at and making sure that they have the appropriate services in place on the school campus so that they meet their academic success as high as they possibly can. So 2 slides from now, I have a list here of examples of accommodations for 504s. A lot of parents will say, well, so my kid doesn't qualify for an IEP, but I don't even know what to ask for. What can be put in place to make sure that my child is going to be successful in the classroom? And really, this is just a brief list of kind of the things that we've noticed that have been helpful for our kiddos, and then all the way up through teenage and high school, is really kind of simplifying instructions, right? Sometimes it's too complicated, and they're already having issues with memory impairment and processing. So if you throw a whole slew of information in front of them, it's really hard for them to follow along. Another thing that's going to be helpful is sometimes providing teacher notes. This is mostly for our junior high and high school kids on campus, where sometimes by providing them teacher notes, it really is going to help them prepare when they're studying for a test, because they're going to know, they're not going to be worried in class that maybe they're not paying attention enough or they miss a big chunk of assignments. So that's going to help them when studying, that they have all of the information they're going to need to prepare themselves appropriately. Extended time on tests. Tests for understanding, not necessarily for facts, right? So a lot of times, if you're asking them to put it in a situation where they're explaining in a paragraph, it might be really hard to recall those words the way that they need to in order to implement it on the page. So maybe just questions understanding factual information about what they're expected to learn is a little bit more helpful for them. Modified textbooks, audio recordings, things like that are going to help them be successful in the classroom, versus just saying, well, good luck, catch up, and I'll give you a week to catch up. That's not always helpful. So we just encourage parents to talk to their child's teacher and the 504 team and saying, hey, what can I do? What can we put in place to make sure that my kid's going to have enough support services that's going to help them learn to the best of their ability. And then really kind of to close it all up, what's the difference? What's the big difference between a 504 and IEP? What's the takeaway? And I'm going to say, basically the biggest takeaway, you guys can keep this to look at, but it's really important that if your child is cognitively appropriate and able to participate in their 504 and their IEP meetings, that they do so. Like the doctor said before, even with their seizure action plans, we want the kids to know what's going on and what services are put in place for them, because they can actively be involved in these conversations. And really, why are we going to put support services in place that they don't find helpful? Right? They're the ones that are dealing and working through these challenges on a day-to-day basis. And so really, if your kids can participate, it's really important that you do include them and you do let them have a say if possible, so that they get the best out of the accommodations and everything that's going into place to help them be successful.